Good afternoon, everyone. My name's Anjali and I'm your host for today's webinar. We begin by acknowledging the Wurundjeri Woi Wurrung as the traditional custodians of the land on which our office stands and pay respect to their elders, past and present. We extend that respect to any Aboriginal and Torres Strait Islander people tuning in with us today. On behalf of the Mental Health Foundation Australia, I would like to welcome each and every one of you attending today's Lunch and Learn educational webinar on adolescent sleep and mental health, presented by Professor Greg Murray. Before we begin, a disclaimer is that this webinar is intended for educational purposes only and should not be relied on as personal advice. Always seek the guidance of your doctor, psychologist, or other qualified health professionals regarding your physical and or mental health. I would now like to introduce our presenter, Professor Greg Murray. Professor Greg Murray is a researcher and clinical psychologist who specialises in bipolar disorder. He is a professor of psychology at the Swinburne University of Technology in Melbourne, Australia. He has a national and international reputation for clinical psychology research, being ranked in the top 1% of researchers worldwide in fields of bipolar disorder, circadian rhythms, personality, and affect. Greg has won multiple individual awards for teaching and research and has provided professional developmental workshops for hundreds of psychologists and psychiatrists around Australia and overseas. He is a fellow of the Australian Psychological Society and is a patron of Bipolar Life, a support group for people with bipolar disorder. He has won multiple awards for teaching and research and has recently won an International Wellcome UK grant for his research on bipolar disorder. Using this grant, him and his international team of researchers in the UK, New Zealand, Germany, and India will examine circadian rhythms in people with bipolar disorder. So please join me in welcoming Professor Greg Murray for his presentation.
Thanks very much, Anjali, for that lovely welcome. And I'd like to welcome everyone who's joining us today. This is one of my favourite topics to speak about because I'm very interested in sleep, and I was once an adolescent and my children were more recently adolescents, and both my parents were school teachers. So it brings together some of my, my primary interests and some of my primary research interests. What we're going to cover in the next 30 or 40 minutes is this. I'm going to briefly introduce you to some features of sleep that you need to understand to be able to understand what's going to come next. And then I'm going to introduce you to a very particular issue to do with sleep, and it's the problem of adolescent sleep. And it's a well-recognised problem. It's not particularly my research that has underpinned this conclusion. It's a global phenomenon, but we have done one large study in Australia with my PhD student at the time, Dr. Suzanne Warner, did this research in Australia. So we've confirmed that the same finding about adolescent sleep challenges applies in Australia as well. And then we'll finish off with some tips about improving adolescent sleep. So let's firstly talk about why human beings sleep. Firstly, it's just common sense, and I think the general public would assume this is the case, but it has definitely been demonstrated to be the case that one of the primary functions of sleep is physical restoration. So during particularly one of the stages of sleep, which we'll talk about in a second, we get lots of growth hormone secretion, we get tissue repair, and fundamental metabolic processes about restoration and maintenance occur while we're asleep. And particularly in terms of the brain, I'm obviously interested in mental health and well-being. So in terms of the brain, it was only relatively recently that we discovered that the brain also gets cleaned overnight through a system which is called the glymphatic system, which is literally getting rid of, from the brain, of the byproducts of brain activity during the daytime. So as you probably know, the brain is a hugely energy intensive organ. It takes a huge amount of energy for humans to run this great big brain that we have that differentiates us from other species. And all that energetic activity in the brain generates a lot of byproducts, a lot of waste. That cleaning is done at night by the glymphatic system. You may have heard of the lymphatic system, which is the same sort of idea to do with parts of the body outside the nervous system, to do with the muscles, etc. You may have heard of the lymphatic system, which does the same job of cleaning for parts of the body that aren't in the brain. But the glymphatic system is talking about the brain in particular and how important, because it is during sleep that this work gets done. But the other thing that I'm sure any of the teachers in the audience will know, and many of us have had experiences of poor sleep and what happens when we have poor sleep. Good quality sleep is critical for cognition. And in fact, there's been a huge amount of research done, largely in the context of shift work and other industrial settings where tiredness is known to be a problem, truck drivers, pilots, etc. So there's been a lot of industry interest in measuring and managing insufficient sleep in the workplace, nurses, professions that do a lot of shift work. And that research unambiguously shows that our cognitive ability decreases significantly, both acutely if we miss a night's sleep, but also chronically if our lifestyle is not giving us enough sleep for one reason or another. And so these features that I mentioned here, executive function, attention and concentration, they are the absolute core building blocks of our ability to problem solve, to think flexibly, to find solutions to problems, to track issues that are coming in front of us. And of course, absolutely critical, those three things, for learning, which is what we want adolescents to be doing a lot of the time. One of the other things that might be not so obvious to us, but there's been, in terms of our experience, but there's been a lot of research showing this, is that sleep is critical for laying down memories. And in fact, there is a different stage of sleep to the one that is mainly to do with physical restoration, a different stage of sleep that seems to be really critical for laying down memories. And you demonstrate that by, giving someone a learning task and then either letting them have a normal night's sleep or preventing them from having a normal night's sleep, and then testing them again on that memory task. And any deprivation or any decrease in the normal sleep for that person has an impact on their ability on memory tasks. But so that's been known for quite a long time. But the other thing that's more recent scientific focus is in that same stage of sleep, which is called REM sleep, or rapid eye movement sleep. It's the time of night when we're doing most of our dreaming. In that stage of sleep, we also process emotional events of the day. And I'm going to talk a bit more about that in a minute, but appropriate management of particularly highly emotional events during the day depends on good quality sleep. And I'll say a bit more about that in a second. And the other thing which we all know just from our own experience when we have insufficient sleep or we're not getting the quality of sleep that we need, there are immediate effects, aren't there, on our ability to regulate our emotions. We are a bit more childlike in our responses, aren't we, when we haven't had enough sleep? So our negative emotions, irritability, anxiety, even anger can be more difficult to control. People can lose their temper much more easily if they haven't slept adequately. And something that we're perhaps not so conscious of, but has also been proven, is that there's also a disturbance to our positive emotions. And what I'm referring to there, think about situations where you haven't had enough sleep. One of the things that you might notice yourself doing the next day is you get what I call the can't be bothered's, right? I can't be bothered doing that. So what does that mean? Psychologically, that means that something that appears like it might be fun or enjoyable takes some energy or effort, and when we're tired, we say no thanks. The motivation, the positive motivation to engage with life, to go and see that movie, to have a hit of tennis, to go out to that restaurant to have a meal with your family, maybe that seems less appealing. I can't be bothered. And that's a second emotion problem associated with poor sleep. And that's where we get to this third point there, that not surprisingly, given those first 2 points around emotion regulation, there is in fact a theory for which there is quite a bit of support, though the processes are complex, but there is a theory for which there's quite a bit of support, that depression is in fact a vicious cycle between sleep disturbance and emotion dysregulation, where poor sleep leads to those consequences I just described. So during the day, I'm more irritable, I'm less tolerant, I'm more frustrated and potentially angry. I also get the can't be bothered and start to say no to things that could have been enjoyable for me. That means at the end of the day, I'm left with more stress, less of a sense of connection to my friends and family, more of a sense of isolation. That is not good preconditions for a good night's sleep. So our sleep gets worse potentially, and we go on a vicious cycle. And that's the theory of depression as driven by sleep disturbance. So across physical parts of being a human, thinking parts of being a human, and emotional parts of being human, sleep is absolutely critical. I'm just going to quickly mention this because we haven't got a huge amount of time today, but I've already mentioned a couple of these things, so I want us to be clear. It is important whenever we talk about sleep to go beyond a simple idea that you're either awake or asleep. Sleep has multiple stages in it. I've already referred to one of those. I've referred to REM sleep here. The other stage that I mentioned before, but I didn't name, is non-REM sleep. That's the stage where most of the physical recuperation occurs. So non-REM, I hope you can see my pointer there. Non-REM is there, REM is there, and wakefulness, which I hope you're all feeling now, though it is in Melbourne, it's 2:15 in the afternoon, and many of us do have a post-lunch dip. So don't feel bad if you are feeling a bit drowsy. I won't feel offended. But it is important to think about this relationship between these three states. Full-blown wakefulness, one of the sleep stages called REM, and one of the sleep stages called non-REM. They're all different, but they actually do overlap. So when we're awake, as hopefully you are now, I know I am, I've got an activated brain, I've got an activated body, and I'm paying attention to the environment. All right? Good conditions to be giving a lecture. When I'm asleep, most of the time I'm asleep, something like 75, 80% of it, I'm in non-REM sleep, various depths of non-REM sleep. That's when I'm doing my physical recuperation. And if you put EEGs on me, measuring brain activity at that time, not much is going on. My body is relaxed. And interestingly, and this is how we know sleep matters to evolution, I'm not paying attention to the environment. It's an interesting choice, isn't it, of evolution, to have an organism like a human being have 8 hours roughly out of every 24 when they're not attending to threats and opportunities in the environment. This is one of the reasons we know sleep really matters, because it's a very unusual thing for an organism to do, is to give up on worrying about threats in the environment and to give up on worrying about rewards in the environment for 8 hours a day. And then there's this unique stage of sleep, something like 20 or 30% of the night, rapid eye movement sleep, where, as I said, we do lots of our dreaming. And I mentioned before that it's heavily involved in memory consolidation and emotional processing. And what's really interesting about REM sleep is if you put an EEG on someone during rapid eye movement sleep, it's called rapid eye movement sleep because your eyes move rapidly during that phase. It's not a very inventive name, but literally you can see people's eyes move under their eyelids during that stage. But if you put an EEG on someone in REM sleep, it's really difficult to distinguish between that brain activity and fully awake brain activity. The brain is working a lot during during REM sleep. The body is paralyzed. The large exterior distal muscle groups are paralyzed. Obviously, breathing, respiration still continues, but we can't act. And one way to think about that is it's nature's way of stopping us acting out our dreams. In fact, if we do act out our dreams, that shows that there's a bit of a problem in the neurobiology of REM sleep, because we're not meant to. We're not meant to be acting out our dreams. We're meant to be paralyzed or immobilized during REM sleep. And again, we have that inward orientation. We're not paying attention to the environment. And I'm just going to quickly mention a couple of things. I won't go into detail, but it is really very interesting to look at these overlaps between the phases. So somewhere between waking and non-REM sleep, we have these very common phenomena, very common in children and remain quite common in adults. They're nothing to worry about normally. Normally, they don't cause anyone much of a problem. Sleepwalking, sleep talking, and night terrors. Night terrors is a very specific phenomenon where typically a child screams in the night, causing everyone else in the household to run into them. And when you get into the child's room, they're in a slightly befuddled state. They're sort of half awake. They don't know why they screamed, right? So quite different to a nightmare. Being woken from a nightmare, that's a night terror. And it happens there at the interface between non-REM sleep and wakefulness. And then we have another set of phenomena that happen between wakefulness and the dreaming state. Some of these are hallucinations. Hypnagogic hallucinations happen as we're transitioning into sleep. So it's literally seeing things. So we are starting to dream, but we feel as if we're still awake. The most vivid, I'll say one more thing and then I'll introduce the incubus phenomenon. The other thing that happens there, and you can guess what this might be, is you actually experience sleep paralysis while you think you're awake. Remember I said during REM sleep, we're paralyzed? That process starts, but other parts of the brain are still awake. So you are aware of being paralyzed, right? So it's a very distressing state. The other thing that's more common, many of us will have experienced this, is sleep jerks. I don't know if you've had this experience where when you're falling asleep, you find yourself waking up, and because you've had some sort of half dream that you're falling and you need to catch yourself. This is at the interface of wakefulness and dreaming, right? And so you have enough consciousness and awareness to think, I'm falling, I'd better do something about it. You're actually not falling. That's part of a dream or some sense related to dreaming. And so you wake yourself up to catch yourself. Some people in this room on this call will have experienced a combination of hypnagogic hallucinations and sleep paralysis. It's a terrifying phenomenon called the incubus phenomenon, but it's a recognized thing. And I describe it very briefly because if you've had it, you need to know what it is. It's not a problem. It's not mysterious, actually, now that you understand the relationship between REM and wake, right? The incubus phenomenon is where you are in bed getting ready to go to sleep, and from your point of view, you are still awake. You have not gone to sleep. And you hallucinate. You see a threatening creature typically advancing towards you and sometimes coming up, I know it's horrific, onto your body and ending up on your chest. And there's nothing you can do about it because you're paralyzed. Now, I can't see you, so I don't know if anyone's now nodding and saying that's me. But in most times when I give this lecture, if there's 100 people in the room, 4 or 5 people will say, yes, I've definitely had that. And now you understand what it is. It's an experience at that state between dreaming and wakefulness. It makes perfect sense when you understand what dreaming involves. It involves hallucinations and it involves paralysis. The unusual thing is that other parts of your brain, you still are self-aware, which is our definition of being awake, primarily our subjective definition of being awake. So, of course, before people know what I just described to you, naturally, what they think is they've seen a ghost. So there are people commonly, or some sort of evil spirit or something like that, right? That's the interpretation that people bring to the incubus phenomenon. But I hope after today, you know that there is a superior interpretation that normalizes that experience if you've ever had it. One more thing we need to know before we get on to the particular problem of adolescent sleep. So let's now think about what determines whether we go to sleep or not. Nature has designed us to have pretty discrete periods where we're roughly, generally, we're either awake or we're asleep. Pretty much, they're typically separate states, though, as I've just said, sometimes they're not, but they're typically separate. And in human beings, unlike some other species, we've been designed to have probably one consolidated sleep period in every 24 hours, one block of sleep. There is another theory that maybe we were designed to have 2, but let's stick with one for now, right? So that's the relationship between full wakefulness and sleep phase. But there's this other really important question about what determines when we sleep. And a lot is known about that. Firstly, absolutely common sense. Just like eating, my hunger is higher depending on how long it's been since I've eaten, right? It's what we call in psychology a homeostatic process. It just builds up over time, hunger. It's been so long since I've eaten, I've got hungry. Same with sleep. The more hours you've been awake, the more prone you are to go to sleep, yeah? We actually understand the mechanism behind that. Adenosine is a biochemical which builds up in the body through the energy expenditure of the day, and it progressively over time makes us sleepy, adenosine. And caffeine, as in coffee, binds to adenosine, takes it out of the system for a little while, which is why people use caffeine to wake up. Of course, the problem is very quickly there's a rebound. And in fact, if anything, we are sleepier half an hour or so after caffeine than we were before it. But for 10 minutes, 40 minutes maybe, we can deal with sleepiness using caffeine. So that's one thing, and everyone knows that. Common sense, right? Another common sense thing which becomes really important in problems with sleep, like insomnia, which is not the focus of today's talk, but in problems with sleep, We know that people can disturb their own sleep by being really anxious or really excited or really engaged in social activities. You can delay sleep by being too aroused. And, you know, the classic example of that in the sleep area is insomnia, where particularly sleep onset insomnia, difficulties getting to sleep. Insomnia, from a psychological viewpoint, is just too much arousal at bedtime. And of course, you can easily understand what that arousal is. If you have insomnia, going to bed is stressful because you are worried that you may not have a good night's sleep. So that there's a vicious cycle there, that the arousal itself postpones and may even, you know, chronically disturb sleep. But that makes sense, doesn't it? We've all had experiences where I was too excited or too worried, or I had concerns and I couldn't get to sleep. Yeah? So that's number two, again, common sense. There is a third determinant of when we sleep, however, and we're not conscious of it in everyday life, and that is the body clock. The timing of sleep in humans and most other species that sleep, and most other complex organisms do sleep. All mammals have REM sleep, but only mammals have REM sleep, but most complex organisms sleep. In all these organisms, humans included, the body clock, which in humans lies deep in the brain, in what some cultures call deep behind the third eye, is one of the determinants of when we sleep. We don't notice that, and we don't normally address it when we're thinking about our sleep, unless we've got a significant problem with sleep, and then your therapist will say, you have to address it. The only time we notice the body clock's impact on sleep is when something very unusual happens to our sleep-wake cycle, like with jet lag. So you may have had this experience where you've flown to, for example, the east coast of the United States, and you've been, you know, you've left Australia at 6 o'clock in the morning, but that meant you had to get up at 4 o'clock in the morning, which means you didn't sleep well the night before, and you've been traveling all day, and it's been a hassle after hassle after hassle, and you finally get to your hotel in New York, and it's 2 o'clock in the morning in New York, and you think, I'm going to sleep like a baby, and you go to bed wide awake, and that's because your body clock is still on Melbourne time. You will not be able to go to sleep at that time, because as far as your body is concerned, it's now, I can't do the maths on the spot, but it's something like 3 o'clock in the afternoon in Melbourne. And so you don't sleep. Your body says, that's not when we sleep. And your body clock won't let you sleep. It won't be putting out melatonin, which is the sleepiness hormone, which is secreted by the pineal gland, driven by the circadian system, and a range of other processes won't occur. The reason we need to know about these determinants of sleep is they change with adolescence. So what is the problem of adolescent sleep? So I keep talking about what's common sense versus what's actually the case. I think many parents don't know this, and they are led astray. So from a parent's point of view, once our children hit adolescence, we kind of get the impression that perhaps they need less sleep than they did before they were adolescents. And they do a little bit, but not much. So compared to a child who's prepubescent and at primary school, there's a decrease of about an hour of normal required sleep. First mention of this idea. As adults, most of us require, on average, 8 hours sleep at night. That's the most common. 8 hours sleep is the most common preferred sleep duration. But there's a big range around that, which is all normal, right? So for adults, it's about 8. You've heard that number before. But a big range, all of which is normal, 10 to 6 hours, or don't consider yourself abnormal if you don't feel like you need 8. But children need a lot more than that. It's 11 or more in primary school kids. And in adolescents, it's not as little as adults. It's still between 8 and 10 hours sleep that they need. The need for sleep has only changed a little bit. But what's changed dramatically is the timing of sleep. The body clock delays. The time when adolescents are ready to sleep is something like 1 hour or even an hour and a half later when they hit adolescence. And other processes, that hunger-related process that I was, that hunger-like process I was talking about, also doesn't assert itself as strongly. So adolescents compared to primary school kids can go longer without sleep before, really hitting the wall. So the drive for sleep isn't as intense for adolescents as they were in primary school. But because the body clock delays and the sleep pressure isn't as intense, there is a significant delay in when they want to sleep, but the actual window of sleep hasn't changed that much. And this is all absolutely fine on school holidays. And so if you know any adolescents, you'll be amazed at how late they can sleep in the morning, right? Compared to adults in their late 20s, 30s and older, it's remarkable how long adolescents can sleep in on holidays, isn't it? They also go to bed later, but perhaps we're not so conscious of that, because if we're older, we may not even know when they've gone to bed because we've gone to sleep 2 or 3 hours before they did. And that all works absolutely fine on holidays. It doesn't work at all during school term. Because as you know, if anything, once we get to secondary school, people have to get up earlier than they did for primary school. So for starters, a lot of people are travelling further to attend secondary school than they did to attend primary school. Class time is often, start of school is often set earlier for secondary schools than for primary school. And at secondary school, there are often preschool activities, extracurricular, sport, music, etc., that happen before classes start. So you've got this immediate, it's obvious, isn't it? You've got this immediate problem. You've got these people, these adolescents, who have, because of good biological reasons, shifted when they want to get their sleep. They need approximately the same amount of sleep as they did when they were in primary school, but their lifestyle is saying you have to get up earlier, so their sleep window gets squeezed, right? The opportunity to sleep in a way that fits with their sleep preferences is significantly squeezed during school time, not during holidays. The other complexity here is the time at which adolescents go to bed. So I'm firstly emphasising the problem of early rising that is required of adolescents. But of course, there are also things that mean that they can stay up later at night and perhaps are pressured to stay up later at night. Firstly, parents can't tell them when to go to bed, so the adolescent is typically making their own bedtime. And secondly, there are increased social interests and obligations. So potentially in terms of interests, friends, social media, etc. And in terms of obligations, perhaps there's work after school, Almost certainly there's study after school. So you try and cram in quite a lot of activity post-school, and already you're looking like a later night of sleep, right? So there are also social factors, apart from the biological ones that I described that tend to shift adolescence later. There are also social factors that enable them to shift their sleep cycle later. That's important for us because we can address those social factors, and that can in turn have some impact on the biological ones. I'm just going to say one more thing about this little story, so you understand it better. The evidence is very strong. Obviously, this isn't a scientific presentation, so I'm not showing you data that supports everything that I've just said, but there is a lot of data from many countries that supports what I've just said. But just to give you a way of thinking about it, this is a theory for which it's impossible to collect data, because it's a theory about evolution and why adolescents might have this phase delay. Why would this be happening? And the theory is that back in caveman days, in what's called the Pleistocene era, when a lot of human nature was being developed and embedded into our genes across millions of years, humans were living in small tribal groups, and we call this caveman days, but that's living in groups. And the theory is that once members of that tribe were old enough to protect the cave, there was an adaptive advantage for the adults, the older adults, to be, responsible for the tribe between early morning and early evening, and the adolescents take over responsibility over the evening period. So they get up later and they go to bed later, and the tribe has almost, perhaps if you also put in the older people who tend to get up earlier than working age adults, you've got almost 24-hour coverage of security for the tribe. As I say, there is no way to prove that. That's an evolutionary theory, but I think it's a really good way to keep in mind what we think's going on here, the difference between working age adults, the difference in lifestyles of adolescents. It also explains one other thing. If that theory is correct, the adolescents looking after the cave, if you like, well into the night after the working age adults have gone to sleep. But what's the other thing the adolescents are doing in the evening? What's the main focus of adolescence? They're flirting. They're exploring, sex and gender roles and identity and power and social relationships. Yeah, of course, that's what they're doing. They're doing that around the fire. They're adolescents. So yes, maybe evolution designed this so they're protecting the cave, but evolution has other intentions for adolescents as well, right? And they're very conscious of them, and around sexual identity, for example, is the obvious one. So I think that's a really nice metaphor to think about as well. If you ever tried to speak to an adolescent about getting off social media at 11 p.m, because that is the fire. You're asking them to leave the social situation, which is the absolute peak experience of people at that time of life, given the drives and the motivations that are very, very prominent in adolescence. So it is no neutral thing to tell an adolescent, get off Snapchat or whatever the current platform is at 11 o'clock at night, because you're never going to be able to get up for school in the morning. It's a big ask. It's a big ask to withdraw from the campfire at that time of night when the parents are not meant to be there and the adolescents are free to explore their emerging adult identity. So let's get back on, away from theory and back onto data. This problem that sleep gets squeezed has been called an epidemic of sleep deprivation in adolescence. Huge amount of work has been done in the United States about this. The work we did in Australia, Suzanne Warner did for her PhD, replicates exactly what's been found in other countries. And it's 77 minutes a night less sleep than these young people get on holidays. So it's during the school week, every night of the school week. So that's Sunday, Monday, Tuesday, Wednesday, Thursday night, 77 minutes less than the prescribed amount, and exactly 77 minutes less than those people get when they're on vacation. We've got the data to show that. So this is a very significant accumulating sleep debt across the week. So that's 5 times 77 minutes, 350, 385 minutes, more than 6 hours, almost 6.5 hours of sleep debt come the end of the school week. What do they do about it? They sleep in on weekends, and that causes a problem. So they're naturally trying to, on average, of course, so this doesn't apply universally to adolescents, of course, but on average, they're sleeping in to try and make up for that sleep debt, and that keeps them asleep until maybe 11 a.m, midday, sometimes in the early afternoon. The problem with that, if they do it on Saturday and Sunday, is Monday morning is a nightmare, right? And if there's any teachers in the audience, you'll be well aware of this phenomenon that many students are actually not present. They might be physically present, but they're not cognitively present in the classroom on Monday morning, which is why some schools have moved to doing outdoor sporting activities in the morning, but particularly Monday morning, to recognise this problem that adolescents are delaying their sleep to a more holiday-like phase on the weekends, but that causes them a problem on Monday. So we have chronic sleep deprivation in adolescence, but there are things we can do about it, and that's what the last part of our talk is about. So the obvious thing, and when I give this talk to adolescents, they all say this: why don't we delay school start times? And that idea has been tested, and it works. A whole lot of studies have shown that if we delay school start times by, say, an hour, and there are some whole school districts in the United States that have done this. California instituted this, I think it was last year. The whole state of California has set an earliest time that school is allowed to start, to recognise the fact that adolescents they're set up to sleep later and need to get up later. So when I say there's evidence that it benefits sleep, health and learning, each of those outcomes has been demonstrated to be the case. There's one qualification to that. In the United States, where a lot of those studies were done, in fact, all of those studies were done, they traditionally started school quite a bit earlier than we do in most schools in Australia, right? So, in fact, those studies are looking to delay school start times up to where we currently do it in Australia, right? So we can't be, in Australia, we can't be so convinced that delaying school start times further would further improve health benefits. But in fact, if you look to the third point there is growing evidence that the more you delay it, the better. So 10 o'clock start times benefit students further. And there are a number of, particularly there's a bunch of private schools in the United Kingdom, and I don't know how this changed, where this community of private schools came from. I don't know how that works, but they have moved towards a 10 o'clock start time. So there's evidence that it's not just the shift in America to more Australian start times that is useful. That's definitely useful in America. The question is whether Australia, further delaying its start times would be useful. And the evidence for that is not as strong as the evidence for that America should become more like Australia in its school start times. But there is a signal in the data that even in Australia, further delaying school start times would be beneficial. Now, of course, delaying school start times is very, very complex. So implementing that is difficult, you know, timetables, teachers' lifestyles, other members of the family, you know, there might be one adolescent, some younger kids, parents working, they need to get out of the house at a certain time, leaving the adolescent at home alone in bed, you know, all sorts of complexities. So there are some guidelines that have been developed for how to think about helping schools delay their start times. And of course, you know, I won't go into what they are, but fundamentally, it's about dialogue between all the stakeholders, school, students, teachers, parents, the bus company, the train company, et cetera, complex network of factors are related to school start times. But it's an obvious thing that is clearly, on the basis of theory and data, worth trying. And then, but that's not going to happen anytime soon. So what can we do for individuals? I've said that this tendency for adolescents to sleep later is intrinsically biological, and I've given you an evolutionary metaphor for why it may have happened. But there are, like with everything biological in human beings, we can either let it run or we can pull back on it. You know, human beings are predisposed to eat deep fried chicken in sweet chili sauce at every meal, right? That's what our genes would be very happy for us to do, but we know that's not good, so we pull it back. And we can do the same thing with sleep. And I'm going to talk about the details of that in a second. The other thing that we need to do for adolescents in particular is to get them to start to think about, just a broad principle, get them to start to think about sleep the same way they think about diet, like the example I just gave you, and exercise. That it's very important that we don't put pressure on sleep. One of the things I haven't highlighted so much in this talk is, I don't know if you've noticed this, but if you try to go to sleep, you can't, right? This is not something that's under conscious control. The body sleeps and the mind follows, is the best way to think about it. But what we can do is set up preconditions that make it more likely that we will go to sleep. We can't make ourselves go to sleep. One of the few things that keeps humans awake, if they want to stay awake, is to try to go to sleep. It's very effective at keeping you awake. But we can set up preconditions that make it more likely that sleep will emerge. And one of the strong preconditions is habits around sleep, right? Sleeping gets easier when the body is trained to expect sleep at around the same time, night after night, week after week, month after month. Just like with exercise, the first run around the block is very difficult, but after you've been doing it for a month, it's a lot easier. You've learnt your habits, you've learnt your rituals, and the body has learnt to respond to those intense energy demands that happen about 3 o'clock every day or whatever it is. These things, habit matters. And then I just need to say one thing. Today's talk is not about sleep disorders, but some of the things I'm talking about today, if people in the audience are experiencing these things, and including adolescents, both adults and adolescents in the audience, there are some sleep disorders that sound a bit like problems getting to sleep, problems feeling tired the next day, you know, falling asleep at school, And if that's you, we really would encourage you to explore it. If there's a consistent pattern where you're having trouble sleeping, getting to sleep, staying asleep, or even waking up too early, and that's impacting your daily function, we call broadly that something in the insomnia area. And it would be worthwhile going to a GP and explaining it to them, because we do have very good treatments, behavioural treatments for insomnia. Delayed sleep phase disorder is an extreme version of what I've been talking about today with adolescents, right? Where this preparedness to sleep is more extreme. So they may not be ready to sleep till 3 o'clock in the morning, 4 o'clock in the morning. That again is something which self-management tips is not probably going to be sufficient to address. And that's where we would want people to seek some assistance. And in Australia, the first point of call is your GP. But here's some self-management tips, the last part of this talk. Remember that adolescents are still meant to get 8 to 10 hours a night, every night. But each adolescent will know themselves. And what I ask is, how much do you sleep on holidays? That's what we want to know. Then they need to work out, what's the challenge? What is a bedtime that works for them across 7 days of the week, not 5? Because that, as I said, that reliability of bedtime and wake time is really important for the habit of sleeping. So they need to think it through. What is a bedtime that they would like to aim for that is going to go as close as possible to them getting the amount of sleep they need during the school week, and then not sleeping in too much on the weekends? A maximum of about half an hour to an hour difference between school days and free days is what we're after. An hour or so, that's fine. If you're sleeping for an hour on Saturdays and Sundays, that's fine. But if it gets to 2-3 hours, that's where we get that social jet lag phenomenon, which causes people a problem. Yep. And then there's a bunch of stuff that people can do in the daytime to help them sleep at night. Active engagement with life in the daytime is the other side of the coin to good quality sleep at night. And some of the activities in daytime that prepare us for sleep are things like eating lunch at about the same time. It's all about training the body about where it is in that 24-hour cycle, which includes a sleep phase. Yeah. Getting exercise each day, preferably early in the morning. The body clock that we've been talking about likes to see sunshine in the morning. It's a really good sort of prompt for the body that the day has started. And so exercising, particularly getting out, doesn't have to be intense exercise, but just walking around the block or walking to school if possible, or riding a bicycle to school, that gives you exposure to environmental light early in the day. The body clock benefits from that, and it helps the body clock prepare us for sleep later that day. And of course, it makes sense that if you are tired, avoid napping, because that decreases the sleep drive, particularly after school. And I hope everyone knows that caffeine disturbs sleep. Something that I find that most people are not conscious of is this rhythm that is so important in getting to sleep. And it's all part of this fundamental idea that humans are designed to be actively engaged with the environment in the daytime and then withdraw from the environment at night. To just withdraw into recuperation at night. You can imagine sort of intuitively that works best when it's a strong rhythm. And by a strong rhythm, I mean a strong sort of pulse. And the pulse is that the daytime should be a time of strong emotional engagement with what matters to you. It's that connectedness to the environment, to your social world, to your friends, to your hobbies, to your achievements and your study, that in turn prepares the body. The body learns, the mind learns, the day is done. I've had a successful day, and that is a precursor for a good night's sleep. And at night, there's a couple of things we need to keep in mind. I'm very conscious of time. We've only got a couple of minutes to go. The bedtime space needs to be dark and cool and uncontactable. We don't want attention on the possibility of being contacted. Many of us have to learn a routine of disengaging from the day, a soothing pre-sleep routine. And if we do, as of course most of us do at various times, have worries or concerns, my rule is do not try and solve any worries or concerns after dark. Write them down and deal with them in the morning. They will not be usefully processed after dark for various reasons that I could explain if I had another hour. Minimize exposure to light in the evening. Light is arousing. And have a think about your social media use. I've already said why I think that's a complex topic. This is a cat getting ready for bed. That's the pre-sleep soothing routine that cats do. Humans can do the same thing. In the morning, it's important to get going quickly. And that means having breakfast early, as close to wake-up time as possible, and getting out of bed promptly. So what we've discussed today is sleep is important. We all knew that. But there's this very specific manifestation of sleep problems, and it occurs in adolescence, and we understand it. We understand pretty well why it occurs, and therefore by understanding it, it gives us pointers as to what to do about it. We could delay school start times, but we can also encourage adolescents to make choices that rein in, that minimize that predisposition to sleep, go to sleep very late, to want to get up very late, which does not work for them during school time. Thanks for your attention.